Hello, military friends and families. This is From the Front Lines. Today we are talking about the mechanics of family benefits, not as a clinical service, not as a medical intervention, but as a non-clinical peer-led response to the reality of transition. We understand gratitude alone does not create stability. We say thank you for your service. We hold ceremonies, but reintegration requires more than appreciation. It requires a structure, and that structure must include the spouse and the child. The Dwyer programs exist because we understand that the battle doesn't always end when a uniform comes off. But we are not doctors. We are not clinicians. We are veterans and family members who have walked the path. We provide non-clinical space where you can connect without a diagnosis. We become a bridge, and that bridge leads directly to professional advocates you have earned. In New York State, 62 counties provide services that help veterans and their families obtain benefits. These agencies and organizations are the ground-level experts. They don't just explain the rules, they file the paperwork. They are the tactical headquarters for your disability claims, property tax exemptions, and much more. They work in direct coordination with the New York State Department of Veterans Services to ensure that every state-level advantage is secured. Financial security is one of the first pillars of that coordination. One benefit is the Veteran Affairs Dependency and Indemnity Compensation. This is a tax-free monthly benefit for survivors of veterans whose deaths were service-related. It is the floor that prevents a family's stability from cracking. For those with a disability rating of 30% or higher, that monthly compensation increases to account for dependents. It recognizes that the cost of service is a household debt. Healthcare is another friction point. The CHAMPVA program exists to share the cost of covered healthcare services with eligible beneficiaries. It is a safety net, but we also recognize the toll on the caregivers and family members helping the veteran. The Comprehensive Assistance for Family Caregivers program provides a monthly stipend and specialized training. It recognizes that the caregiver is the most critical person in the veteran's ecosystem. Then there is the future. Education is the bridge to the next generation. Through Survivors and Dependents Educational Assistance, known as Chapter 35, spouses and children receive monthly payments for degrees or vocational training. And through the transfer of the post-9/11 GI Bill, a veteran can pass their educational legacy directly to their children. This is strategic reintegration. The Dwyer Program can assist with being that point of entry to this entire network. Because we know the first year after service can determine the trajectory of the next 20 or 30 years. We know getting to the VA is not a smooth process. We understand the VA ecosystem is not perfect. Within that imperfection, we know the system is complex to navigate because obtaining your benefits is not a single-day task, rather it is tedious and overwhelming. And we know throughout that journey comes frustration and discouragement. Gaining stability requires coordination across employment, healthcare, education, and so much more. The resources are there. The New York State Department of Veterans Services Help Line is available at 1-888-838-7697. The local County Veterans Service Agency offices are staffed and waiting. The Dwyer Project is ready to walk with you through the gate. This is not charity. It is strategic support for those who have given everything. Because if we are serious about veteran stability, then the bridge home must be as strong as the bond in the field. That is why we exist. Reach out to your county representative today. Connect with your local Dwyer chapter, and let's secure the home front together. For more information, you can visit the Dwyer Program official website to learn what activities and events are happening in your community.